So I'll give you another example here. Here's a person, lots of people come in and they're like, I got flashes, I got floaters, things moving around, I don't know. So every time a flash happens, it's literally a tug on the retina. So here's an example of a patient. As you can see here, you see this black stuff. This is a floater. It's a little bit black because it released some pigment, which is called Schaefer sign. But as you can see, everything looks good here. But there's this little thing down here called a retinal tear. It looks like a U, so we call this a horseshoe tear. This type of tear is very significant. It can cause the retina to keep falling off, like I said to you before about a retinal detachment. But this is way out there that could easily be missed on normal fundus cameras. So I'm going to show you a patient. This is the importance of getting your eyes checked, especially for diabetics. So here's an example of a person with diabetes. As you can see here, it looks really bad. There's a lot of blood leaking out. Also, you have, I don't know if you would be able to appreciate it, but there's these little collateral neovascular nets, okay? So when I look at this person has PDR, which is called proliferative diabetic retinopathy, meaning that they created bad blood vessels. But this person right here, all this stuff is happening, and this person is probably seeing 20/20, and their vision is great because this is not affected. So people come in, yeah, my visions are great, and you can like look and all this bad stuff is happening. I'm going to show you an example of the other eye where, as if it's not treated or caught earlier, as you can see, there's a lot of dark red here, which is a lot of blood. And this is basically when one of those bad, weak blood vessels burst and cause leakage of blood in there. And the problem with having these bad blood vessels in our eye is it can start to attach to the vitreous, which is the jelly part in our eye, and cause pulling of the retina and cause a detachment. So that's why it's very important to get your eyes checked if you're a diabetic.